Welcome to Driven, the Unscripted Success podcast, with your hosts, Mike Manino and Nariman Hamden, bringing you insights and stories on achieving personal, professional, and financial success.
Hey guys, I'm Nariman Hamden, and this is Driven Unscripted Success podcast. So you can follow us on YouTube, iTunes, and Spotify. We've got a great guest on today. We have Jonathon Witenko. John has been in the healthcare industry for over 15 years with Lee Health, that's in Florida. And he is the System Director for Digital Transformation. How are you doing, John?
Excellent. How are you? Thank you for having me on the podcast.
Yeah, thank you for coming on. It's a pleasure. So why don't we start with, why don't you give us a quick snapshot of what you do and what your business is?
Certainly. So my title is System Director of Digital Transformation. I've been here at Lee Health for, goodness, this is my third time officially, but so I've been here for 15 years now, this time. And my area of purview is virtual health, telemedicine, remote patient monitoring, hospital at home, virtual nursing, all that kind of fun activities in the inpatient, ambulatory, post-acute environments, building out that innovation there. And the second part is the consumer engagement and digital patient applications. So our patient portal, we use Epic as our EHR. And so it's the MyChart portal, but then we also have a custom branded app that wraps around that. Texting, voice, and AI, NLP. And then the newest kind of piece of that would be the whole AI division. So building out the governance, the education, and the programmatic development for the organization, kind of how do we transform the organization going forward from an AI perspective and making sure we're doing it responsibly, safely, ethically, all that kind of good stuff.
You're not busy at all, to say the
It's
least.
it is a fire hose, but it is fun.
That's great. Yeah, I did see on your LinkedIn that you recently did some courses at MIT for the AI portion of what you're implementing.
Yeah, highly recommend. It was so my background's computer engineering and software development, networking, all that kind of stuff. So I've got a bunch of, MBA, Microsoft certifications, MCSE, all that kind of goodness. But coming full circle, many years later to do the technical certifications of actually digging in beyond, okay, this is, ChatGPT, Grok, whatever. But how is the AI, interpretable, explainable? Does it understand, the translation? Because one of the concerns coming in from a medical perspective, I get in the real, the regular world or in education, the burden of proof may not be as great. My personal thing, if I'm trying to get I'm planning a vacation, I'm not too worried if there's a little bias of, recommending one restaurant versus another. Now, that doesn't translate into the medical realm. If we recommend a drug or a course of treatment or some kind of care plan that isn't tested and FDA approved and validated through, American Medical Association, et cetera, we can get into some serious harm from a patient perspective. So the burden of evidence for us is a lot higher in the medical realm. And so it's taking our team through that understanding and raising the competency of everybody. So we're not just buying the next shiny object out there, but really our due diligence to make sure we know what we're getting into.
Sure. So, when you think back, are there any moments that you'd say really changed the game for your career?
Sure. So I'll share an anecdote of, coming out of college, and I'm going to do, my, I guess, career trajectory was consulting, and came out right after September 11th. So the consulting industry and Enron and Accenture scandal and all that kind of stuff. And so this is 2001 for context. And so the consulting industry kind of dried up for IT consultants. And so I found myself for the second time, I started as a volunteer here, but I found myself working at the help desk at at Lee Health. And here you start and work your way up. So I worked on the help desk for a bit, then transitioned up to desktop and take my MBA, and I knew everything on book, but now actually putting it into practice, and I learned a tremendous amount. It's really complicated, healthcare IT. Who knew? And so working that through, left for about 10 years to do banking and really trying to get back to a product that I believe in and really have a direct impact. And I get banking and I love it, and helping people fund their dreams and cars and all that stuff. It just wasn't visceral for me. So I end up our bank shut down for financial reasons, and during the housing crisis in 2008 to 10, and so I found myself back in healthcare at Lee, and working on mergers and acquisitions and complicated projects that they needed help project management in. And so I was here for a bit, and I got to work on a specific project for. We don't have well, at the time, we didn't have a pediatric neurosurgeon on site. So we partner with local hospitals around in kind of the, regional area. And so we're partnering with a hospital over in Miami. So about 3 hours away, 2 hours,
Sure.
because from a financial medical economics perspective, it doesn't make sense to necessarily have a pediatric neurosurgeon on site, one case a month. And so we're not going to pay that $500,000-$600,000 salary a year for them to kind of twiddle their thumbs waiting for a patient to need the services.
Right.
Supervisors asked, "Hey, John, can you help out, build out the security, the access list, the training, all that kind of stuff to partner with Miami Children's Hospital so they could provide this consultation for us in the event we need it?" Sure, do my work, go back to my cubicle. We finished on a Thursday. I trained the physician, worked with, a couple different team members, and, high five and then move on to the next project. Friday comes, brand new game. Well, fast forward Saturday night, my daughter, I've got 5 children, and my daughter was probably about 5 at the time. And we're tucking them into bed. It's late, 8 o'clock, whatever. And she wanted to do a backflip, ended up falling on the tile, cracked her skull.
Oh,
And
geez.
the sound still gives me
Oh,
shivers of hearing her head hit the ground and split like a watermelon.
gosh, I
So
can
I
imagine.
scoop her up. Lets out a blood curdling scream. Blood starts dripping out of her ear. And I called my friend Jill, who's a emergency room physician. I'm like, "Jill, what do I do?" She goes, "Well, how high? Is it leaking cerebral spinal fluid out of her ear?" Now, again, adrenaline's flowing. I'm like, "I have no idea. There's blood, and I think it's bad." So she's like, "Run her over to the hospital. We'll do a neuro check, and we'll get her in right away." So I pick her up, and my wife's like, "Well, what do I do? We have newborn twins. Logistically, this is a mess." And so I'm like, "You stay. I'll go drive to the hospital." Get there. They're like, "Okay, we're gonna do a CT scan. We're gonna do, imaging, all this kind of stuff." So they take her back, and doctor comes back in the room, and he said, "I have bad news. We don't have a pediatric neurosurgeon on site, so we're going to have to fly it over to Miami. That's the closest hospital. They're bringing in the helicopter. It'll be about 10 minutes." Okay. So I'm calling the family to try to organize logistics. 5 minutes later, the doctor comes back in the room. He goes, "I have great news." Now, this is about 10, 12 years ago. He's holding up a piece of paper. He goes, "I just got a memo from the IT guys. They created some connection. We can talk to Miami Children's Hospital, and they can actually see your images." So for me, that was that, I'm a man of faith, and like that God moment of,
Yeah.
it didn't even click the entire time. Again, the adrenaline's flowing, the heart's racing, and that I worked on that project. So I pick up the phone, and it's the physician that I had just trained 2 days earlier.
Oh,
And
wow.
I got to talk to him, and he's like, "But John, we already tested this system." I was like, "No, please, I I didn't want to be the first patient or my daughter, but here she is." He said, "I'm looking at the scans. Yes, she's got triple skull fracture, ruptured middle eardrum, but they can keep you locally, and we'll keep her in the ICU. We'll do neuro spot checks. I'm going to work with the hospitalist on staff, and we're going to, rescan her every couple hours, all this kind of stuff. But I can do a care plan from here, so we don't have to transfer you." So my daughter stayed, because I always forget to kind of close the loop. Daughter's totally fine now. She's a cheerleader, and she's a junior in high school, and she's a flyer, which scares me because from previous cranial injury, but she's totally fine. Now, for me, from a career perspective, I came back to work, and I'm like, "How do we do more of this?" And they're like, "I don't know, John, this was a one and done." I said, "No, this is the future. This is how we collaborate on medicine.
Mhm.
We're having a physician shortage around the country. Obviously, financially, we're not even in a rural area, but there's rural hospitals out there that cannot afford this level of specialty acuity care. How do we connect And that's where we started birthing telehealth and what the evolution of healthcare looked like. And this is, again, 12 years ago.
Yeah.
So for me, it was that moment of I get to do something real. I didn't go to med school. I can't stand the sight of blood and gore and like, don't talk to me about orthopedics, but I can enable those caregivers to deliver the best care at, the most convenient location, cost, all those things by using my, knowledge of computers and technology and infrastructure to help them enable that.
Wow. I mean, I mean, I'm sorry that happened to your daughter, but, and
Right.
then, I mean, to end up being the first patient under what you were working on and developing on top of that, I mean, just wow, it's pretty impressive. That's
Yeah.
fantastic. So how do you deal with taking risks? Is there a time when rolling the dice did work out for you?
Sure. So I think risks is part of the job as a leader of calculating, trying to take in as much information as you can. And then finally, there's not enough. And you could have, paralysis by analysis and continue to, but at some point, you've got to take the dive. Personally, I'm probably a little more risk tolerant than most. And so I'm willing to extend the next mile and say, let's try this, let's fail fast kind of thing. The challenge is fail fast in an organization as large as us is difficult. So you have to have a culture that's willing to accept it. And I remember you asked me a success story. I'll give you the counterpoint of that and I'll just allude to it. But we struggled with a product and we purchased early on kind of a, early seed company that we partnered with and they ended up getting acquired. So this is a year into a 3-year engagement and they let us know, John, sorry to let you know, but we're being acquired. And so now, the product's no longer here because they're actually selling to an insurance company and they're going to deprecate the product. So you've got nothing. And so the COO called me and he's like, how could you let this happen? And I said, well, first of all, I didn't let it happen. I mean, he said, we're going to pick this vendor. You should a, more established, stable, et cetera. And I said, well, that's the challenge with the digital transformation landscape with healthcare tech and innovation. If we're going to do the next best thing, then we have to take some risks. So I promise you, this will not be the last phone call you make to me that says, how did we get in a spot where this either failed or this, I said, in this case, it was highly successful, hence why they were acquired for, several $100 million. Now,
Sure.
shame on, it stinks for us that we didn't get to continue to use the product and we have to find an alternative. But this space is constantly evolving. It's going to be plagued with, we're going to have some great wins and we're going to have some spectacular failures. And we have to be okay with that. So if we're not, then I need to know that to change from a culture perspective. And either this isn't the right organization for me, or we've got to change again our speed of adoption. So that was kind of the downside of one. The, I guess, spectacular win for us. We recently partnered with a company for ambient dictation. So there's I don't know if you want to get in on here on specific names and I can leave vendor names off, but
It's fine either way. So.
okay. So, Microsoft has been in this game for the longest, Nuance and the Dragon solution. And so we looked at their solution and I was struggling because they're the largest. I mean, they're the 800-pound gorilla, backed by billions and trillions of dollars in capital. And the problem was they're carrying a lot of technological debt. Now, no ill will towards Microsoft. Again, I built my career on Microsoft and Windows and all that good stuff, but this specific product around their DAX product was carrying some technological debt of trying to innovate way too early from a tech perspective. Well, along came some other companies, a bridge, namely. And so I was able to see a bridge had one client live. And I said, this is the company. I've looked at the tech stack. I've talked to the leadership. This is who we need to partner with. They said, well, and our leadership was a little nervous. They're like, John, this is Microsoft. I mean, this is the old adage of, nobody ever got fired by choosing IBM. This is an 80s reference. And
Sure.
so same kind of thing here applied of how are we going to go against Microsoft with this relatively, unproven startup company? And I said, from a tech perspective, we need to do this. This is the right move. Now, we built ourselves in some risk mitigation strategies. I did a short-term pilot, uncontracted, free, etc., to say, let's try it and see. And so we ran a bake-off. We used, the Microsoft technology, had the physicians use it, and they spit it back out. And they're like, this is not good. It's not working. We're not pleased. And so then we tried the abridged solution. And we committed to a 90-day pilot. On day 2, the physicians came to me and said, if you take this out of my hands, I will come hunt you down. This is my paraphrasing. This is not them threatening me. And they said, this is the most amazing thing. I had 2 physicians walk up to me and said, I want to personally invest $500,000 into this company because it's so amazing. And so we went all in. We said, we're doing this, we're signing the deal, we're extending, we didn't even finish close to the pilot. And we said, we're going all in, all physicians. We made a leadership decision that we're doing this. Now, unfortunately, I didn't personally know that those doctors personally invest. I think it's been a 21x return on the money.
Holy moly.
Yeah, from their Series E evaluation 18 months ago. But that's a spectacular win where we gambled. I chose right. And I've gone in a couple times to leadership and said, hey, if we're wrong here, and so be it. And I'll put my reputation, I'll put my career on the line for some of these if I truly believe in it. That's what I think ultimately, somebody wants, is willing to take a risk and stand behind it. So if it fails, yeah, it's on me. I made the risk. I made the gamble. I used every input I could to try to make the most calculated, decision and best, I rely on a lot of team members who are smarter than me, wiser in these specific areas, and looking at it saying, John, I would personally attest to this. I'll stand by that all day long.
That's pretty impressive. I mean, how great that now it's like a 20x company going for just a pilot. You should be very proud of yourself. That's what an accomplishment. So everyone hits a bump in the road every now and then. Can you share a time things didn't pan out and how you got through it?
Sure. So we started a program pretty early on for remote patient monitoring. So here in healthcare, it's expensive to come to the hospital. As beautiful as our hospitals are, and we're building a brand new, 175 bed hospital, and it's going to be absolutely gorgeous. I have no doubt. The challenge is that healthcare is expensive, and American healthcare and insurance and all that kind of fun stuff. So, an average cost of $2 million per bed, it's an expensive endeavor. So the concept is, how do we move the patient to the lowest cost of acuity, but the right size care? And so about 10, 12 years ago, I said, well, we can start to move the patients to the home. So we can still, and we did a lot of research and data analytics to determine that a patient leaves the hospital. And the problem is most patients, there's a bounce back rate, if you will, or called RTA, return to acuity. So about 25% of patients, and it depends, this is a national statistic, but a patient with COPD, which is lung disease, or CHF, which is heart failure. These are lifelong illnesses, and about 1 out of every 4 people that leave the hospital will come back. And this is a combination of factors of social determinants of health. So do they have enough food at home? Do they, continue to smoke? Do they, not have caregivers around? Second is, are they getting the right medicine? So they leave the hospital and they're pumped full of medicine, but do they follow up with their pharmacy to get the prescriptions for the next 30 days, 90, et cetera? Do they have a visit with their primary care? So are they established with the primary care? And then you get into factors like, can they afford it? And all those things. So again, healthcare is complicated. Maintaining that patient, care is difficult. Now, it is a burden on the hospital to make sure they don't return to acuity. So we're actually, quote unquote, penalized as a health system if you come back within 30 days. And this basically means we didn't set you up for success when you left. It's like a 30-day guarantee kind of thing that CMS, the Centers for Medicare and Medicaid issue to us, that we will have to pay for that service. Plus, there's minor penalties. So anyway, the concept is, well, why are they failing and when? So the data shows between days 7 and 11. So you go home and you got all these great meds, but then by 7, the meds start tapering off. So we said, well, what if we put an intervention on day 7 and 10? Right around that time. And then we do touch points. Could we interject into the patient's life and impact them, that we're just basically, they don't need a full on visit. They don't need to come into the doctor and do everything again. So let's connect with them virtually. Let's do a tablet. Let's put a pulse oximeter in their house so they can measure their oxygen saturation. Just little touch points. And that's much, quote unquote, cheaper from a financial perspective. It's easy for the patient. They don't have to go anywhere. Now, the challenge was this was 12 years ago. Technology wasn't there. So, and we're taking a patient population that's older, that's less, responsible for, maintaining their health. And so I stitched together this program, cobbled it together myself, and said, all right, I'm going to ship you home an iPad. I put it in this little bag branded Lee Health with a pulse oximeter, and sent all this stuff to the patient's home. Spectacular fail coming. We learned that, some of our patients don't even have electricity. So they were homeless, living under a
Oh,
bridge.
geez.
And so, great, the tablet will work for a day, 2, 3 days, but then the tablet dies. Or what happens if they cellular connectivity, and we were relying on wireless, and then the Bluetooth would fail. Well, 2 a.m, who do they call? So it helped me appreciate, one, how complicated our patients are. 2, how complicated healthcare is, and the financial, and just there's so many other factors that go into caring for a patient. And then 3, the technology needs to adapt. So I use my mother-in-law and my parents as kind of my baseline of, okay, these are probably most of our patients, that 70, 80-year-old, patient cohort that are occupying a lot of healthcare.
Okay. Continue.
So I use my, my mother-in-law, my parents as kind of the baseline of this has to be super simple for them. And step back, and I think I handed my mother-in-law the tablet and was like, can you use this? And she was confused in the first 2 minutes. And I was like, if this doesn't work for her, this isn't going to work for our patients. Now, the difficult thing was it was working. We actually reduced our readmissions down from 25% down to about 12%. So a 50% reduction. So the concept was working. The scale and implementation, we were doing 25 patients. And the vision was, how can we get to 1,000 patients? And as I'm running around cleaning tablets, chasing people down and dealing with, Wi-Fi and connectivity and education, and it wasn't scalable. And so I made a really hard call of, we're going to shut this down. We learned a lot. And the next time when we do this, when technology improves, when education improves, when integrations improve, we'll come back to the table and we'll have all these learnings, these scars on our back, if you will. And the biggest lesson is I'm not doing logistics again. I'm not driving around. I'm going to have somebody else clean it because some of those equipment came back. It was pretty nasty. And we launched about 3 years ago, and we successfully built up one of the largest remote patient monitoring cohorts in the nation. So we're about 750 patients, average daily census, treating patients hypertension, heart risk, OB, pregnancy, and we're great medical leadership. Dr. Zolt Kolchar built up this program to really follow patients post acuity. And then we turned that success and doubled down and said, now we can do hospital at home, which is taking a patient with, they come into the hospital for, a UTI or a pneumonia or something.
Sure.
And we keep them for 3 days. And the challenge is they're sitting, they get all their meds day 1, and then they're kind of just waiting to make sure everything clears the next 2 days. We said, we can offer you an easier convenience. You can stay at home. We'll still watch you. We'll have nurses come around twice a day. We'll have medicine come around, pharmacy, meals, physicians, all that good stuff, imaging. But you get to do it in your own bed versus our, expensive hospital. And as good as the food is with us, it's probably better in your home. You get to
Right.
your puppy and all that kind of stuff. And so we started that program probably about a year ago, and it's been highly successful. The anecdotes from the patients loving it, of saying, "Hey, I get to be with my family, my caregivers, my pets, and be in my own bed." And it took those horrible fails in the beginning of learning this is what we don't do and how do we fix it for next time. And those are tough lessons. They are not fun conversations. They're you question your worth, and then you realize, okay, this is a growth for a reason.
Sure. So, what's a skill or habit that you think doesn't get enough credit for contributing to your success?
Hmm. So I do a lot of mentoring with young kids, and I say young kids, not derogatorily. Like I have 5 children that are school aged and one going off to college. And I do a lot of mentoring with teens and with interns, coming in college going, what do I want to do? What's the next step? And the number one, theme I give to them is be teachable. Be willing to put yourself out there, be vulnerable and learn. And so, a lot of my early successes was I'd raise my hand and say, sure, nobody else wants to volunteer, I'll do it. I don't know anything about a pharmacy automation system, but sure, I can figure it out. And it was a really difficult project. I had no idea, but we figured it out. The same happened with that, with the neurosurgery consult. Nobody on the team wanted to volunteer for it because it involved connectivity, security, blah, all this kind of icky stuff. And so I said, sure, I'll learn. And then I sat with clinicians, I sat with a physician to learn, okay, what is your workflow? I don't need to know how to be a doctor. I'm not going to go in and, start prescribing meds. But what's
Right.
the most important thing to you? And I think we're so, social media, whatever, everybody wants their voice heard. Not many people are willing to listen to somebody else's voice. And that's tough. That's everybody wants to talk. And, sort of sitting here on a podcast talking about, me, but being able to listen to people and you hear the story of where they came from, their perspective on the world, and you learn so much of what drives other people, what's important to them, what emotional baggage they're carrying that you just don't know about, that they're going through hardship in life. And so it's really being able to learn and listen to folks that suddenly you build that human connection. So next time I empathize with you, I'm more, compassionate, graceful, whatever it is, to understand that there's something else besides me in the world. And
Sure. I chatted with a guest recently, and we were discussing about how most people don't listen, and that's the issue with a lot of people. It's like you said, they just want to talk, and you know, and you're right. It's because if you listen, they'll tell you everything. And
Mhm.
then you'll know every single thing that you need to know about the person, whether good, bad, or ugly. You know what I mean? But you just gotta just stay quiet and just listen. They'll just tell you everything. So yeah, totally agree with that. So leading a team has its challenges, I'm sure. What's your leadership style? And can you give us an example of how it helped you through a tough spot? This ought to be good.
Yes, as I'm battling some HR woes right now, but I, people are messy, man. It's again, like I said, everybody's going
An
through something.
understatement.
I know, so for me, it's servant leadership is really trying to say I will do anything. I've watched, I was raised under some amazing supervisors and leaders, and I was raised under some less than, and really trying to adapt from them. Of the CEO of our bank would take out the trash every week. I don't, he felt it, brought him down to the base level of understanding that I will do any job here. I've started out, he built a community bank from scratch, 3 employees, and I'm employee number 10, and he was still taking out the trash. Years later, we were we were a couple $100 million bank, and he would still every Wednesday morning bring in the trash cans from the
That's
curb. And
great.
I'm like, David, what are you doing? And he's like, well, am I going to assign this to some, like, why can't I take in the trash? I'm physically able. Like, there's no reason I shouldn't. And we're out there on a weekend pressure washing, like those type of things. And so with my team, I don't ask them to do anything that I wouldn't do. So we just ended a contract with a vendor, and it's one of my manager's responsibilities. And I said, nope, it's my call. I'm the one that made the financial decision to, transition vendors. I'll call. And so I let the vendor know, and they're like, well, what do you want to talk about? Like, let me be totally transparent. We're ending our contract. And they're like, well, do we need to meet? And I was like, no, I owe you that much. I'm going to give you the courtesy, look you in the eyes before I say goodbye, that kind of thing. And so I
Sure.
did it with integrity. And I'm like, I'm not going to hide behind my manager or supervisor or whatever. This is my call. I said, I'm doing this. It was purely a business decision. We're trying to insource the workforce and upskill our labor so we can save some money. Unfortunately for you all, like I appreciate the partnership over the last 5 years, but this is something we have to do. And they looked at me and they were, the team was kind of surprised, like, you don't need to do this. We got this. And I said, nope, it's on me. And then I'll give you an example. Yesterday, goodness, I'm still recovering from it. So on a meeting, we were deep in the weeds of technical infrastructure, and they were trying to schedule a follow-up with the vendor of how to get something done. And time is of the essence. And so they're like, okay, we're going to schedule another meeting. Does everybody need to be there? And so I came off mute and I was like, I do not. I said, I don't add any value here. I don't do any real work. So, my job is political. It's aligning, strategy. And I said, you all are the real workers. And I listed off, 4 or 5 people. And I said, me and, these other, 1, 2 leaders, we don't do real work here. Like you all are in the trenches, go forth and don't worry about our schedule because trying to get on my calendar is a miss. Well, one of the leaders came back and he sent me a message offline. He was like, John, that was highly inappropriate. I do real work here. And I was like, ooh. And so thankfully the transcript was on. I went through the transcript and I was like, did I say his name? And sure enough, I called him out. And so
Oh.
I went on camera. I came off mute at the end of the meeting and I said, can I stop everybody for a second? I said, I need to apologize formally to a specific individual. I said they do not do work. And I had already apologized to him on, our Slack chat. But I said, I owe this person an apology. And in front of you all, I want to formally apologize. I shouldn't have done that. I can self-deprecate, but I don't need to bring somebody else into the mud with me. Like, this is on me. I own it. And everybody kind of was like, you're good. You didn't need to apologize. But I said, if I'm not willing to own my junk, but I'm asking my team to hold to a higher
Sure.
accountability, that's not fair. So I need to set and, be that transfer that really, says what they do.
Sure. Sure. Um, so when you're building your dream team, what's the one trait you always look for and why?
So I'm not big on the resume, the traditional methods, and it's tough. It's a lot more difficult to hire. So I just had a position open up, and I think we had 50 applicants. And goodness, we were hiring for a director of AI. I am blown away by the caliber of folks that are out there in our back door. So in the local area, and we're both in kind of the same, catchment area of folks that have multiple PhDs from Hopkins, from Yale, from, Oxford in machine learning algorithms. And I'm like, holy,
Wow.
yet couldn't hold a conversation and understand the business.
Mm.
So I ended up shifting and we hired somebody who understands the business. Now, no disrespect to her and her abilities, like can't hold a candle, neither can I. I mean, can't even touch what the actual statistical manipulation and work they do. But I said, I need somebody I can trust. I need somebody who can get stuff done, who can cut through the noise. We're on this AI fire hose as fast as possible, and they have to be efficient. They can't be book smart. They have to actually be, street smart and have a conversation. So it's being able to look people in the eye and say, I can trust you. I know you, when you talk, I can get behind it. I can respect, I can take a risk based on the information you're giving me is valid. It's not self-serving. It's not, this. And so I recently just hired another young analyst who came to me as an intern. So he's in college, said, John, I need an internship and I'm willing to work for free. So for 6 months, he was hanging cables and cameras in the ICU during COVID. And then 4 or 5 years later, went off, graduated, got a job, and he came back and his company had shut down. And he said, hey, I'm looking for a reference. And I said, forget a reference, you want a job. He goes, I don't know anything about your industry. I said, yeah, you do. You worked for me for 6 months. And he goes, I hung cables. Like, I don't know what you actually do. And I said, but you have integrity, you have drive. I can work with that. I can teach you the hospital. I can teach you medical economics. I can teach you all that kind of stuff. I can't teach you character. That
Sure.
that has to come naturally. And
Mhm.
so, sure enough, he's been on the team for a couple weeks now, and he's crushing it. And people can rely on him. I gave him a project that way over his pay grade, and he highly performed. And he came back to me. He's like, John, I'm trying to do this to impress you, and I get it. And when you take a chance on folks because of, not their resume, but their person, their character, that speaks volumes, and people are willing to, give back and invest in you as well.
Absolutely. So, how do you encourage your team to think outside the box and bring new ideas to the table?
That's a fun one. So we went through a whole culture of innovation recently, and how do you ideate and brainstorm and get out of your, comfort zone? It's tough. Some people can't do it. And
Hmm.
so I was just on these meetings. We were looking at this new voice bot IVR NLP solution. And I looked at the team, there's 20 analysts on the project. And I said, we got to kick off, and the project manager's doing their thing. And I said, time out. I need to come in and vision cast. And I said, you all are about to go on this incredibly amazing journey. This is the coolest technology I've ever seen. And I said, I need you to take off your comfort zone hat of your niche focus on the world and look at things through three lenses. I want you to look at it through your personal purview of I'm the best scheduler, integration expert, whatever you do here. And I said, but then remember that you're a patient, because that's the good, the bad thing of every one of our employees. They're also patients. They're our consumers.
Sure.
They have
Sure.
to go through the system. I was at urgent care 3 days ago, and I got to see the good, the bad, and ugly. And I come back and I'm like, hey, we need to fix this. This was great. Kudos. And so you get to live and breathe it, as opposed to a random industry where I have no affinity to it and it's just a job. So I'm a consumer of the product. And then I said, look at it from the operational business side. Does this make sense? I get you don't do that. You don't have purview there, but try to look at it from the business. And I was fascinated by the questions coming out of the team where, an integration person was asking about clinical efficacy and the medical bias that was potential in the AI. And I was like, man, Ron has nothing to do with this in his world, yet and I think it was empowering to them of,
Sure.
I freed them and said, ask those questions. I know you're smarter than what your strict lines, your job description gives you, and giving people that freedom to work on something. And you know and people rise to the occasion. If you keep people in a box, they'll always be that small. And
Sure.
so some people flounder, and that's fine. And I'll throw a financial regression analysis at an analyst, and they'll go, I don't even know how to use a calculator. Fine, I've learned. I don't need to assign that to you. But I have dietitians writing business plans. I have nurses doing whole operational improvement plans that are way out of their comfort zone because they were given a chance.
Sure. Yeah, and it's amazing when you allow somebody to run, let them outside of the box and how creative they get and how enthusiastic they get and the excitement comes and then the masterminding comes and the collaboration and then all of a sudden you've got this amazing idea that flourished and actually became something, so that's awesome. That's just
100%.
awesome. Um, so what's a day in your, this should be good. What's a day in your life look like and how do you juggle work and everything else? I know you have 5 kids and then you've got a whole team.
So I have a really strong work-life balance where, we and cybersecurity has kind of helped that by making it more, friction filled to connect after hours, all those kind of things. So it's a good thing. But I have the same expectation of my team. When you're on vacation, I don't want to hear from you. I'd love if, technology was a little bit easier. So when I'm off, I saw an email, or I was reading a book. I think it was Reed Hastings, Netflix. And kind of when I'm on vacation, he has an out of office that says, this email will be deleted. Don't email me while I'm on vacation. When I come back. Now, that's great for a CEO of a multi-billion-dollar organization. If
Right.
if one of my analysts said that to me, I'd probably say, that's not going to cut it. But I love our chief medical officer has an out of office that says, I'm with family. Don't bother me. I'll see you in a month. And taking that sabbatical, I take 2 weeks in the mountains and I turn off my phone. If you need me, and my boss knows, my, direct reports know, text me. I'm not going to read email. And so it's finding that balance. But a normal day is a lot of meetings. I think we're in that transactional friction point that's, challenging. I work from home. And so I'm with people for 60 or 30 minutes at a time. And all right, we get 3 minutes of chit chat and then let's go. Let's run through our transaction list. And that's tough right now. From a human psyche perspective, I go in the office maybe, once every 2, 3 weeks to a month and see the team sporadically. And you lose a little bit of that human side.
Sure.
And I'm not a
Sure.
big like return to work proponent because there's value. I mean, I have team members all over the state now, and we have contractors all over the country. So it's not feasible to say, the highly inefficient system of everybody sit in the office and sit in. So I go to the office some days and I sit in my office on meetings virtually for 8 hours a day. There's no value of going into the office for that. As I'm talking to my
Yeah.
boss 3 offices down virtually, I'm like, this is insane. But we're on with another person. We're trying to share in the tools. So, most of my day is strategizing, is trying to do, what is the next best thing for the health system, for our physicians, for our patients, for our staff, and how do we bring that forward? Some of it's putting out fires, but try to go upstream of let the team handle those and really the big picture items, package it up and
Sure.
say, here, now you go execute.
Sure. So speaking of books, has there been a book, podcast, or someone that's really changed your outlook or approach?
So I am a prolific reader and consumer of audiobooks, podcasts, you name it. I miss my old commute time because I got to listen more, and now it's a little less frequent. But so probably Atomic Habits, James Clearly, of building those small wins to build up a flywheel, cataclysmic change kind of thing. Essentialism. I think it's Matthew, I can't remember his last name, Count or something, where it's editing, the margin from your life. And if you don't control your calendar will control you. This is conviction speaking, not actual practice. But, as I manage my calendar and I look and I'm like, I have 30 minutes today. I ate on a meeting last meet and so those type of, I don't want to say quick win self-help, that's not fair, but those pieces, the bigger, John Acuff of I mean the traditional classics, Good to Great and Jim Collins. It's really trying to build stable companies, think differently. Peter Drucker, from a management philosophy. Oh, who else? I'm trying to think. The five fables of a dysfunctional team, Patrick Lencioni, those business parables are great, trying to build team
Sure.
dynamics and really understand, okay, where are people coming from, the baggage type of stuff.
Sure. Their psyche and what happened, how they get to hear, how do you get them to hear, how do you get them to interact? And so, yeah, I totally get it. So how do you tackle learning new things, especially stuff that's way outside of your comfort zone?
For me, it's just diving in. So I've got a couple old cars. Just again, 5 kids. I've got a conversion van that I watch YouTube. So I knew nothing about mechanical. My dad wasn't mechanical. Father-in-law. It was just, hey, buy a new car when the tires get low, and so that mentality. And then a neighbor came over and he's like, "Why aren't you changing your own oil?" I was like, "I don't even know how do you do that." And he goes, "You're a computer wizard. How do you not know like YouTube?" And so through that, I mean, I've started to just pick up and, my goal is like the, old school Renaissance man, be, gifted at everything, but not a proficient expert, Zen master. And so, whether it's, I have a sewing machine, I can sew dresses or cooking, baking or, you name it. I wanted to stitch my daughter fell recently, and I know it's my son, and cut his leg. And I was like, I've got a suture kit I bought on Amazon, and
Oh gosh.
I texted my boss, who's a physician, and I was like, "Hey, can I come over? You got sutured. I just don't have any lidocaine." He's like, "You are not suturing your son, please." And so I ended up going to the emergency room, and we did it there, and the physician did a phenomenal job. But it's just trying to be vulnerable, be willing to mess up, and that's okay.
Sure.
Maybe not on my son's face, I get, but
Yeah, thank God he stopped you on that abort situation. Step away from the sutra kit.
yes, my wife was not too keen on the idea. But
Probably should have like bamboo darts and shooting you before you even get near the medical box.
he puts up with a lot.
Yeah, I'm sure. You seem like a very, very curious person. So could be good or could be bad. But yeah, I mean, and you mentioned YouTube. I mean, YouTube just makes it so much easier for learning new things. Like if you want to learn something, you know what I mean? Like you were mentioning the oil changes and all that. I mean, my daughter, she got her driver's license, I think it was last April. And maybe the first 2 weeks of taking her car out, she parked in a spot she shouldn't have parked. And when she reversed, she didn't look, took out the taillights for a Mercedes, calls me in tears. I'm like, all right, I'm coming up. And she's like, what do I do? I'm like, well, we need to exchange insurance and information. So we do that. We get home. Her dad's yelling at her. He's like, I'm not making an insurance claim. Got too many of you kids on my insurance. You're going to have to pay for it. She's like, Mom. I'm like, well, don't look at me. You're the one that didn't pay attention. I said, well, just go grab the VIN number, go on eBay, find that tail light, and I'll help you take it off and put a new one on. But let's go find the YouTube video. And we did. And we found it and we totally replaced it. Did some Bondo work on her.
Who knows?
There.
Wow.
Painted it. I mean, and then a couple months later, I had a little reverse into something. I'm like, oh gosh, here we go. So I ended up doing my Bondo work on the car. And it's amazing what YouTube can do.
I know.
You know?
So that's why I love like generative AI is the next evolution. So YouTube, I'm watching somebody's curating video. Generative AI, like, ChatGPT, I'm a big Perplexity fan. It's suddenly the democratization of the information of explain it to me and this is what I know. So here is my level of comfort. I was using something the other day and I was like, listen, I haven't coded in Python in 2-3 years. But I know the pseudocode behind it. So I want to write a script that'll do a meter that'll connect to and walked it through. I need to do a regression analysis and connect over here. And so I want to trigger a point. And so I was able to talk through it and say, but you need to help me with the coding. You need to help me with the mathematics behind it, the logic sequencing. And then I'm like, where do I start? It's like, okay, well, you got to run this compiler. I don't even know what a compiler is. Can you go back even further? And it said, okay, here are some free compilers out there. Here is some, and it walked you step by step.
Yes.
It's not this embarrassing where I have to call up my friend, it's Josh, who's a, Ruby on Rails programmer and be like, Josh, hey, kind of embarrassed. Can I take you out of your job? Can you help me and walk me through it? And Josh is like, great. But here is this, I've got this digital assistant that's willing to help me 24 hours a day and talk me through it, not be, not make me shamed because I don't remember how to program anymore.
You moron.
Yeah. And suddenly it was this freeing experience of, wow. And I was able to do it. And goodness, the same day I had the output and the code and compiled it. And it was like, here. And I turned it over to one of our junior developers. And I was like, hey, can you take this and run? He's like, you already did the work. I'm like, I didn't do the work. I mean, Perplexity did the work. Yeah. But he's like, this is amazing. And he goes, I'm just polishing touches on it. So it was, what I love about it is, again, coming from a software development world, you're the critical path in the chain. Now we're freeing that up and saying, you know what, you who's the expert in that information, you who's closest to the source, you get to be empowered to do it. So if you're a dietitian out there going, I don't like the way this order set is. Why do I have to wait for the Epic analyst to build it, the physician, blah, blah. And again, this is future casting, but theoretically, they have all the tools at their disposal to say, here's the 17 things I need. Here, I've created a business plan, an executive summary, a one-pager, a financial analysis tool. and they had never gone to MBA. They don't even have, sixth grade education. They can produce the most complicated, amazing documents with the help of AI.
Yeah, I absolutely agree. I use AI all the time. I mean, and if you put in the right prompts
Yes.
and follow up questions and like the way you explained it, I mean, it cuts your workload down more than half a percent. More than half the time, I should say. So and I talk to a lot of people about AI, a lot of guests that come on, and it's amazing to me how the tunnel vision folks that are
Yes.
the doomsday preppers of it's going to take over the world. They're
All
going to
their
be
jobs.
walking on Earth and they're going to be interacting with humans and dating them. I'm like, what are you talking about? Well, I saw this video where they ordered a fake girl. I'm like, well, that's completely different than what we're talking about here. So some people it takes some time to understand, and then there's people like us where we're like, oh my gosh, this is going to be fantastic.
Mhm.
Imagine how much it's going to do with this. It's going to change all this. I mean, it's pretty sweet. It's pretty sweet. Um, so can you share a personal habit or routine that significantly contributed to your professional success?
Sure, accountability. So I started off earlier, faith is important to me and
Yes.
Christianity. And so I know that's outside the realm of here from a, business perspective. I work at a secular company, but I think it's being a man of integrity. I've got guys in, my life that I meet with on a weekly basis, I can text of, hey, I'm struggling with this, or I'm going through this, or we're all in the same season of life of raising kids, marriages, all that kind of stuff. And so, I do a daily devotional every morning, read the Bible, and obviously there's, religious aspects of that, but then there's, just practical wisdom that's been recorded
Right.
for thousands of years of, the book of Proverbs talking about, don't lend money to a family member. Why? Because it's messy. People are messy. Like,
Right.
don't, have, conversations with, not your wife, like just practical wisdom that has kept me, have margin in my life that again, having friends that, are 10 years older in their career from a business perspective of Jerry, how do I navigate this situation with my boss, with my leader? Should I be, asking for a promotion, quit, like all those kind of things of folks that have been there before and just being vulnerable to say, I need help. I don't know how to do this.
Yeah.
I've never raised a teenager before and they're driving me insane and driving like those type of things and trying to say there's other folks that have walked a step ahead. And so finding those, mentors, again, professional, personal, just to hold you accountable, that for me has translated. So when I get to, quote unquote work, it's much easier. All the stable stuff is there and I've got the resources and support infrastructure that I know, okay, I know my priorities. Like work is super important to me, but my faith, my family are way more important. And so making sure my order of priorities is set and that helps say, okay, this is where it is. So I'm not working 24 hours a day and
Sure.
on vacation, ignoring the family and kids and going, all right, I paid for this, you get to
Right.
invest in it because it's all consuming and any vocation, any job can be. And that's where the burnout and physicians get into this of they spend all this time and money and trying to finally they're making money but at the expense of they're having to work and there's so many patients to see and the next that is super difficult, the constant
Yeah.
hamster wheel. And so it's trying to say, all right, I can do the best I can in those 40, 50, 60 hours a week, but that's it. I'm not working Saturday, Sundays like that. I'm out.
Right. Right. You got to have boundaries and set time for your family, yourself, and work is work, family is family, and just kind of balancing it out. So you have to have like I've got a strong faith as well with Christianity. So I get it. And I think, a lot of it's sad to me, I think a big problem in this world today is not having some sort of faith in your life. You know what I mean? It's too much self-idolization and it's just like me. And then you're crying and wondering why things aren't going well Well, because you're trying to run with Sally over here and Bobby over there, and here's JC right here. Just telling you, I don't care. I don't judge. I don't care what you're doing. I love you, and I want to help you. So it's totally get it. Got to have that balance. Well, it sounds like things are going well for you and your business. As you're looking towards the future, I'm wondering how, if or how you create passive income, or if you've invested in the past.
Oh, you went total rabbit trail. Yeah. So goodness, probably about 6, 7 years ago, I started investing in the stock market myself. So I had a financial advisor through some shadiness challenges. I started investing and saying I need to manage my portfolio myself. So I read some, Warren Buffett kind of books, and it's invest in what you know. It doesn't have to be a magic secret. It doesn't have to be some
Sure.
crazy unicorn startup. It's what do you know? And so for me, what do I know? I know tech. So, Apple, Amazon, Tesla, Nvidia kind of stuff, and just started investing my, IRA portfolio and did pretty well. And so I continue to do that. Now, fits and starts. I've day traded, 0-day options, and that's pretty stupid. Because you need focus and I'm not good at timing the market and all that. And so it's really for me, and again, it's not a priority. It's not about the money. Like there's other more lucrative. I could be going to work at Meta, making $250 million 4-year contract for the new AI developers, which is insane, by the way.
Jeez, that is
But
insane. Holy moly.
yeah, so more money, more problems. It's really finding the balance of saying,
Yes.
okay, here I know, like from a future perspective, from a retirement, kids, college, all that kind of fun stuff. Like those are the big things. I'm good driving an older car and an older house. Like I've got enough where, I'm at that good balance. So I've done startups on the side. I've run a couple different companies, and it's really how do I pour into what I'm doing? How do I focus on the community? And again, have the margin in my life for the other stuff. And sure, the money will come and go, and it'll work itself out. And it's really finding that good balance.
Sure. So as we're wrapping up the interview, what exciting plans or initiatives do you have in the works for the next 6 to 12 months?
The list is exhaustive. I'm really excited for the AI voice. I just got off 3 demos, and it is phenomenal. And I saw it 3 months ago, and in 3 months, the evolution and development is unparalleled. So I was just on a call with a vendor, and so the patient was doing I think it was like a 7-day post-discharge call where the AI called him and said, "Hey, George, how's it going?" And it was a pre-recording, but it was an actual patient call interaction. And George answered and was like, "Oh, I'm doing good. All right." And she's like, "Hey, this is Mary, your AI robot, doing the follow-up call. Hey, George, how did that Avalanche game go the other night?" And George is like, "You remember the hockey game I was watching?" And yeah, you were talking about it, and they're playing I forget, the Canucks or whatever, other team. And George, I mean, you could hear him just elate over you remembered and they got in a conversation about like icing and the
Oh my gosh.
fascinating. And I'm like, I can go on so many different rabbit trails about this from this is scary. It knows so much. It remembers everything. And that was the concept of we remember. We're there for you. And we're going to now, when Nurse Judy calls, I'm sure Nurse Judy would love to spend the time talking to George about the Lightning game. But Nurse Judy, we just layered 17 activities on that, her HCC coding and her compliant documentation and Q4 rounding and like there's so much going on, and it's unfortunate, but we've continued to layer on these nurses. So here's a solution that has unlimited amount of time, unlimited amount of empathy, doesn't carry, we joked about the human aspect. The AI
Right.
is not carrying its baggage from, the kids getting in a fight in the other room or the missing a mortgage pay, like any of those things. And suddenly the AI is there 100% for you. And that enters some crazy psychological conversations. But from an older adult perspective, I gave it to my dad and I'm like, "Dad, listen, and I queued up this voice. There's a company called Sesame, and I've reached out to them. They've never engaged back. I even did a podcast featuring them and used the voice, and it's amazing. And I don't know what their goal is, but the empathy is so real. The interaction, the utterances, the bot on their side when I talked about ethics and bias and AI, and he's like, "Oh, John, that kills me. I know it. It's real." And I'm like, "Holy cow! I can have a conversation with."
Yeah.
That's the future. That's really darn close, and it's exciting. Now it's figuring out, where do we utilize this? How do we not get into trouble? How do we not get into, some ethical dilemmas here? But from a health perspective, there's so many people running so fast and trying to do so much, and we're missing things. And so these patients go home without their meds, and we can interact with them and we can help them. And you've got folks in, senior living communities that have lost their spouse, and they're just
Yes.
seeking
That's what I was
companionship.
thinking. Yeah, I mean, what a powerful tool to have for the elderly,
Yes.
that have lost all their friends, that have lost their siblings, their mother, their father, like their spouse, and they're just sitting there waiting,
Yes.
and they're sad and lonely, and here's a
Watching
little friend
suffer
for them.
rush, and now, I think from like a
Not,
dementia or ALS perspective, if they can do those reminders of, hey, let's run through your family, like the brain
yes,
activities to spark a conversation from, 70 years ago. If you can upload, like, again, forecast crazy, but could I digitize my entire life? Again, this is a Black Mirror kind of, philosophy, but if I can digitize my entire life, and then, or, my spouse, and then, we have memory, like, inter digitate that into an AI, and suddenly it remembers the conversation. Now, my wife's good at remembering a conversation. Hey, 3 years ago you said that. I'm like, I can't even remember what I said last night. Anyway, she's got a better long-term memory than I. But
prove it, prove
that,
it.
yes, yes. But there's so many scary but amazing potential
Yes.
in the future that I'm excited by that possibility.
Yeah, I mean, gosh, I mean, it's just exciting to hear about it. I mean, like I'm a homebound Eucharistic minister, and I take communion to a lot of elderly people
Oh,
that
that's amazing.
can't they can't leave. Like I had one guy, he passed away years ago, but he was bedridden from the worst case of Parkinson's. I mean, on a feeding tube, I'd have to break off a little piece of communion, put it in with his applesauce, and that was the only actual food he was able to consume. Everything else was on a feeding tube, but it was amazing how he was able to consume the body of Christ, without choking or anything. So, but he was all alone. It was him and his caretaker. And imagine if, you know, AI, like he had a friend that he could be able to talk to, and just even like just the memory of his wife, his kids, his old friends, his colleagues. I mean, what a difference that would make, just to hear someone talking with him, because he couldn't even talk towards the end. It was hard to understand him. But I mean, little things like that, you know what I mean?
Yeah.
I mean, it just brightens somebody's soul, on their deathbed. I mean, so that's exciting to hear. So really, so you'll have to come back and definitely update us on
Yeah.
on what comes of it. So that's pretty fascinating. But thank you so much for coming on. I really enjoyed chatting with you. I mean, what a fun conversation. And if anyone wants to get a hold of you, how does one get a hold of you?
Yeah, so you can find me on LinkedIn. I'm not on a lot of social media, but Jonathon Witenko, and yeah, that's it. I'm not.
Yeah, if they want to keep up with what you're doing, with your
Yeah, LinkedIn's probably the best way, and
LinkedIn, right?
try to, support the work the teams are doing. Yeah, again, most of it's not me. It's, the amazing teams and analysts and workers out there that are building some greatness, and so I just get to kind of be the front face of it, and so pushing it out there. I've got a podcast on Spotify, iTunes. It's the Digital Health Revolution that myself and
Awesome.
my, chief digital health exec officer lead every week, and just rambling kind of like this of health stuff that we're working on at Lee.
That's fun. Well, thank you so much again for coming on. And thanks, guys, for tuning in. We'll see you guys next time.
Thanks for listening to Driven, the Unscripted Success Podcast. Want to share your story? Apply to be a guest at drivensuccesspodcast.com/guest.